Good morning again, class. Batch 34, Year 4. For today, I will talk about planning, monitoring, and evaluation. The content of the lecture will be in three parts. In planning, we will talk about the uses, types, and steps. Number 2, in monitoring, we will define monitoring and the steps. And lastly, evaluation will define the types of evaluation and also the process. It is hoped that at the end of the lecture, students will be able to list the uses of planning, describe the steps in the planning process, define the types of evaluation, and construct the steps in evaluation. So we start with planning. What is planning? Planning is the process of thinking about the activities required to achieve a desired goal. It is the first and foremost activity to achieve desired results. In health planning, it is the process of defining community health problems, identifying needs and resources, establishing priority goals, and setting out the administrative action needed to reach those goals. When we do planning, we use available and future resources in a cost-effective way. And we will be able to match limited resources with many problems, eliminate wasteful expenditure or duplication, coordinate efforts and actions, and develop the best course of action to accomplish a defined objective. Why planning is important? Because it increases efficiency, reduces business-related risks, facilitates proper coordination, aids in organizing, gives right direction, keeps good control, helps to achieve objectives, motivates the personnel, encourages creativity and innovation, and helps in decision making. There are many types of planning. Number one is based on time frame, what we call is a short-term planning, which is generally 1 to 3 years. Meeting needs as defined by current trends and using available resources and reallocation of resources. Then number two, we have medium-term planning, which is about 5 to 10 years. It modify demands, recognize new needs, and obtain new resources. And then we have the long-term planning, which is more than 10 years, in which we select a desired future and design a way of reaching it. Another type of planning is planning at the different levels. For the top managers, we have strategic planning, in which the setting of broad and long-term goals. For the lower level managers, we have technical planning, which is identification of specific short-range objectives. And then we have the operational planning, the setting of work standards and schedules. And lastly, we have contingency planning, which is backup plans in case the primary plans fail. When we look at time frame as well as the different types of planning, we can look at the frequency of use and also the approach adopted and the degree of formalization. So in strategic planning, normally is a long-term time frame and it is directional. Normally is single use and the approach is proactive and is formal. Whereas operational planning is short-term, it is specific and it is standing and it is more informal. According to Spielgel and Company, health planning is of various types. We have what we call as problem-solving planning. It involves the identification and resolution of a problem. Example, if the problem is dental fluorosis, the community formulates a plan to solve it. And then we have program planning. It entails designing of a course of action for a circumscribed health problem. Example, a school-based fluoride rinse program and school dental service to reduce prevalence of dental caries. Coordination of efforts and activities planning. This is done to improve availability, efficiency, productivity, and effectiveness of health systems. Example is emphasizing healthy diet choices for better living. And there's planning for the allocation of resources, in which it involves selecting the best alternative to achieve a desired goal when the amount of resources is limited. Example, utilizing the help of community leaders and NGOs to reach out to the people. Planning of dental health services. WHO in 1976 described 6 main stages of planning. Number 1 is situational analysis. Number 2, problem identification and formulation of objectives. Number 3, formulation and analysis of alternative strategies. Number 4, identification of special efforts. 5, strategy selection. And lastly, program formulation. This is a diagrammatic view of the planning of dental health services. Okay, we go to situation analysis. This is the first stage and crucial step in the planning cycle, and it should aim at assessing the current oral health situation, its strengths, weaknesses, opportunities, and threats. Assess oral health needs and expectation of the population, and providing an evidence-based informed basis for formulating future strategic directions for oral health sector. The next stage, which is the problem identification and formulation of objectives. The overall aim is to meet oral health needs of the population. That is the different needs that you can find. Traditionally, normative needs is used, and objectives formulated must be realistic, achievable, and measurable. Formulation and analysis of alternative strategies, in which all alternative strategies are examined carefully. It must be cost-benefit analysis and various combination of preventive measures, different ways of providing dental services. Identification of special efforts. Proposal of change must be tested on a small scale to judge its value. So special efforts conducted to reduce the extent of risk. Example, we have the pilot studies. Then we have strategy selection. Most desirable strategy is selected after considering all feasible alternatives and their advantages and disadvantages. So it involves all groups, not only technical experts and administrators, but also providers and consumers of the service. In program formulation, we plan the detailed implementation after strategy selection, and it should indicate precisely what should be done, by whom, when, and what cost. The plan should include a description of the method of evaluation and how to collect the data. Then we come to the steps in planning. So basically, the steps will start with identify the problems, determine priorities, develop program goals, objectives, and activities, identify all the resources, constraints, alternative strategies, develop implementation strategy, and then we go to implementation, and after implementation there is monitoring and also evaluation. So number one, in the steps of planning, we identify the problem. How do we do that? We conduct a needs assessment. The reason is to ascertain the cause of the problem and to identify the extent and severity of a problem. And we also want to evaluate the effectiveness of a program by obtaining baseline information. There are a number of informations required: the population profile, income of the community, standard of living, diet and nutritional levels, geographic distribution, oral health status, healthcare facilities, manpower, education system, public transport system. So it depends on what type of planning that you are doing. And they can be further breakdown of the different information that is required. And what we want to note here is that we should think of population priorities and also take into account the views of health services and the demands and the public concerns. Okay. After we identify the problem, we have to determine the priorities. We have to understand that with limited resources, it becomes necessary to establish priorities so as to allow the most efficient allocation of resources. So if priorities are not determined, the program may not serve those individuals or groups who need the care most. And then number 3, we have to develop the goals, objectives, and activities. So the program goals are usually broad statements of the overall purpose of a program. So normally we have what we call as the SMART goal, which has to be specific, measurable, attainable, relevant, and timely. This is Healthy People 2020. So what they hope to achieve is to attain high quality, longer lives free of preventable disease, disability, injury, and premature death. And that is the health outcomes that are targeted towards promoting quality of life, healthy development, and healthy behaviors across all life stages. So they look at the determinants, and Healthy People 2020, the results should be out by this year. And in Malaysia, we also have the National Oral Health Plan, which is as a plan which was developed much earlier to look at the key goals from 2011 to 2020. So in oral health condition, normally we look at dental caries, periodontal condition, dentition status, and the oral cancer. The key goals will be analyzed, and we hope we will get the information this year to see whether the goals have been achieved. And at the present time, they are now doing the National Oral Health Plan for 2021 to 2030. Okay, in the steps of planning, we have the program objectives. As I said, it is more specific than the goals, and it describes in a measurable way the desired end results of the program. So, it is a tool through which goals can be met through precise action. So, the objectives would specify the WH and the 1H, the what, who, where, when, why, and how. We have the whole outcome objectives, which provides a means by which the outcome of the specific objective can be measured. This approach helps the evaluator and community know the direction and the extent of the program. It focuses on what the target population will know and will be able to do as a result of the program or activity. It specifies the end result of the program. Then we have the process objectives. It states a specific process by which a public health problem can be reduced and prevented. So as I mentioned earlier, the 2020 goals. So we have all the stakeholders and contributors in order and the strategies which have been implemented towards the specific goals. Another step in planning is activities. So once the problem has been identified and the program goals and objectives established, the next step is to state how to bring about the desired results. So the area of the program planning is referred as program activities. The activities include what is going to be done, who will be doing it, when will it be done. Resource identification. An essential step in the planning process, as it will affect the strategies of implementation. Therefore, there are two basic types of resource implication: within current resources or via resource reallocation. And there is additional resources such as manpower, money, materials, skills, knowledge, technique, and time. So this is the fourth step of planning. And what are the criteria used to determine the resource? So we have broken down to 4 criteria. One is appropriateness. So we look at the most suitable resource to get the work done. Then there is adequacy, the extent or degree to which the resource would complete the job. Effectiveness, how capable the resources are at completing the work. Efficiency is the cost in terms of money and time spent to complete the work or the program. The fifth step is to identify constraints. Many constraints and difficulties might occur in a planning process. The obvious constraints to meet the program objectives must be determined. So, by identifying these constraints early in the planning, one can modify the design and the structure of the program for better results and outcomes. So example, if there's a constraint in the lack of funding or labor shortages or the governmental policies and restriction. The sixth step is identify alternative strategies. So we have to be aware of the existing constraints and the given available resources. And when we have to identify the alternative strategy, it can be more effective in attaining the objectives. So example of a strategy, the mobile dental squad versus the mobile dental clinic. So the use of this different modules is that we look at the place and the availability of the vehicles and also the area, the location. Develop implementation strategy. So an implementation strategy for each activity is complete when the following questions are answered. Again, we look at the who, what, where, when, why, and the how. So the 5W and the 1H. We have to ask questions and we have to be able to find the answers. So the planning process, when we do, first we have to look at where we are. So normally we look at the program summary or the organization summary, our strengths and weaknesses, opportunities and threats, and the competitive environment. Where are we going? So in general, we look at the mission and vision, the goals and objectives. And how are we going to get there? So we have to create direction. So we have to make use of the different marketing and sales, finance, facilities, and the management. And how will we know we have arrived? So we have to track the progress. We have to find different indicators or measure the program, and we have to monitor the financial results. Okay, that's ends the first part, which is about planning. Next, we come to implementation. Once we finish all the planning, we have to be able to implement what has been planned. So implementation is the process of putting the plan into operation or action. So normally a health program can be divided into 4 phases. Pilot phase, which is development proceeds on a trial and error basis. Control phase, where a model of a particular program strategy is run under regulated conditions to judge its effectiveness. And then we have then actualization phase, where a model of the program strategy is subjected to realistic operating conditions. And finally, operational phase. So this is where the program is on an ongoing part of the structure. So once we have implemented the plan, we have to monitor. So monitoring is the process of maintenance of ongoing watch or follow-up over the activities of a health service. It uses the observations as a basis for continual modification of goals, plans, or activities. The data collected for monitoring include input data, financial reports, process data, specific objectives, and output data, the services and the goods provided. So we look at the school oral health service in Malaysia. So we have planning, as I had said earlier, and implementation. And when we have a monitoring, so the component of monitoring in a school oral health service, in which the monitoring should be carried out on a scheduled and regular basis by the State Deputy Director of Health, the senior dental officers and the officers, as well as the dental therapists. So the process of the planned activities is monitored through indicators. So we have the QAP program, NIA, DSA program agreement, the KPI, and the national oral health plans and goals. Once we are done with monitoring, we have come to the next stage, which is evaluation. So what do we do in evaluation? Evaluation measures the degree to which objectives and targets are fulfilled and the quality of the results obtained. It measures the productivity of available resources in achieving clearly defined objectives. It measures how much output or cost effectiveness is achieved. It makes possible the reallocation of priorities and of resources on the basis of changing health needs. WHO in 1972 defined evaluation as the collection and analysis of information to determine program performance. It is mostly associated with the final outcome and other factors. It is measured on the basis of effectiveness, efficiency, appropriateness, and adequacy. So what do we mean by effectiveness? Effectiveness is the extent to which planned outcomes, goals, or objectives are achieved as a result of an activity, strategy, intervention, or initiative intended to achieve the desired effect under ordinary circumstances. Okay, example, a vaccine is effective when it is capable to produce the desired effect in the population. Being effective means achieving organizational goals. Being efficient means achieving goals with little wasted resources. The three valuable variables that are useful in evaluating effectiveness are resources, activities, and objectives. So doing the right thing, that is what leads to effectiveness. Okay, next we talk about efficiency. Efficiency is the ratio of the output to the inputs of any system. An efficient system or person is one who achieves higher levels of performance relative to the inputs. So this is the example I have given you below. So we measure the outcome and the output versus the resources, time, and money consumed. Efficiency is a measure of the resources spent in the process of providing a healthcare program. So this is doing the things right. And then we have appropriateness. Appropriateness of a program will be judged by lay decision makers. They will weigh up whether the program identified by the personnel is a problem for the community. The strategy of the program is effective, but it may not be appropriate. Adequacy. Adequacy is a measure in which the extent to which the population in need was covered by the services, or to which the services covered the various aspects of the underlying problem. It should be distinguished from effectiveness, which is a concern only with the result of the program. Okay. In evaluation, we have different types. Okay. So we have formative and summative, which is the major classification. And then we have relevance, process, effectiveness, impact, and efficiency. Summative is more external, so it covers completion focus on results, reviews, and deconstruction process, whereas formative is internal. It is in progress, focus on steps and the building process. As I said earlier, formative is the internal evaluation of the program. It is usually carried out to aid in the development of a program in its early phase. Summative, it judges the merit or worth of a program after it has been in operation. It is an attempt to determine whether a fully operational program is meeting the goals. It helps in deciding upon the continuation or the termination or the modification of a program. Relevance evaluation. What do you mean by that? It refers to activities designed to determine whether the program is needed or whether the program is targeting its efforts at the individuals in need. So in formative, we have needs assessment, evaluability assessment, structured conceptualization, implementation evaluation, and process evaluation. Whereas summative will look at outcome evaluation, impact evaluation, cost effectiveness and cost benefit analysis, and also meta-analysis and other secondary analysis. Process evaluation. This refers to the efforts made to assess the extent to which the program implementation complies with the program plan. The assessment of the program's operation with the consistency of the planner's original intents allows early adjustment and modification. And we also have what we call effectiveness evaluation. It refers to whether program results meet predetermined objectives. So the emphasis is on immediate outcomes of the activities and whether these activities meet the activities specified by the program planners. And then that's what we call impact evaluation. This is a long-term, refers to the long-term outcomes of the program. It considers whether the intervention had any long-lasting effect on the target population that the program was designed to meet. So it is actually an expression of the overall effect of a program on health status and socio-economic development. Then we have what we call efficiency evaluation. It is to relate the result obtained from a specific program to the resources expended to maintain the program. So this is one of the example. Okay. Having talked about the different types of evaluation, we come to the steps in evaluation. So number one is to determine what is to be evaluated. Number two, establish standards and criteria. Number three, plan the methodology. Number four, gather information. 5, analyze the results. 6, take action. And lastly, if there is a need to re-evaluate. So we look at what number one step. Determine what is to be evaluated. Resources, process, and outcome evaluation. Establishing the standards and criteria. In planning the methods, so a format must be prepared for gathering information and in keeping with the purpose of evaluation. The gathering of information. Evaluation requires collection of data or information. So the type of information must include political, cultural, economic, environmental, and administrative factors. These factors influence the health situation as well as the morbidity and mortality statistics. And then we analyze the results. So once the information has been gathered, the analysis and interpretation of data and feedback should take place within the shortest time feasible. Opportunities should be provided for discussing evaluation results. So one of the analysis tools used are the SWOT analysis. So we look at the internal origin and external origin, and the strengths, weaknesses, opportunities, and threats. Number 6 is taking action. For evaluation to be truly productive, emphasis should be placed on actions. So the action designs to support, strengthen, or modify the services. This may also call for shifting priorities, revising objectives, or development of new program or services. So lastly, we have what we call as re-evaluation. So the evaluation is an ongoing process. So we have to examine again so that new changes may be considered. It is mainly aimed at rendering health activities more relevant, efficient, and effective. So it's actually, the whole thing is actually a cycle. So in summary, when we look at planning, monitoring, and evaluation, it all boils down to a systematic way of providing services and to and then monitor and finally evaluate. So we have to establish, gather information, analyze, develop, implement, and finally do monitoring. So oral health or disease and non-communicable disease burden. So when you look at this, so there are many factors influence all the determinants as well as the environment and other external factors. So all these have to be taken into consideration when we do planning, monitoring, and evaluation. And with that, I end my lecture for today, and these are the references that we have to be aware that there is such thing as a National Oral Health Plan for Malaysia, which is till 2030. So this is the old report which you can find 2011 to 2020. It is not a report, it's actually the plan. The report will come this year. And we also have other plans which have been developed till 2030 globally. And with that, I thank you and wish you all the best to batch 24, year 4. So till we meet again, have a pleasant and safe day, and goodbye.